So we've been, hi Amanda, we've been working through some treatments today, and we're on to a little bit of a craniosacral treatment for you for your low back pain. And we're going to be very mindful of your low back and just making sure you're really comfortable. So I'm going to get you to hop up on the table, please. And we're going to be, first of all, doing an assessment of the listening stations. Really just trying to figure out where we're at with your rhythm of your craniosacral rhythm today. So what we're going to be assessing is what's called SQUAR, and this is an acronym that is for symmetry, quality, amplitude, and rate. And symmetry, what we're looking for is we're comparing left and right for symmetrical movement around the midline. And we're going to be looking for the internal and external rotation, comparing inspiration to expiration. And the quality, we're looking for is it smooth or ratchety, and the amplitude, does it meet its full potential? And we're also looking for a rate, the cycle rate of 6 to 12, and the seconds per cycle of about 5 to 10. And we're going to give this an overall rating by region of 0 to 3, just to see where there's a possible dysfunction happening. So we're going to first of all start at the dorsum of the feet, looking for the dorsiflexion and plantarflexion movement. So that's about an overall rating of about a 2. So I'm just going to mark that down. We're going to go down to the heels. Again, through assessment, we're going to look for internal and external rotation. That's also about a 2. Coming up to the shins. Looking for symmetry, quality, amplitude, and rate. Okay, that's about a 2 as well. Thighs. Let's put a 1. And ASIS is going to be coming onto your hips. Is that okay to touch? Mm-hmm. I don't feel any movement there, so that's a 0. Going on to your ribs. It's an overall rating of about a 1. The shoulders. It's about a 2. We're going to be going into some vault hold, so we're going to be touching your head. Your vault hold 1. Vault hold 1, we're going to be assessing the tentorium cerebelli. We're going to be looking at the sphenoid bone, the temporal bone, and the occiput. So it's going to be coming around. We're looking for the widening on inspiration or flexion and the narrowing on expiration or extension. Putting 2 fingers above and 2 below. I don't feel anything there, so that's going to be a 0. And then vault hold 2, we're going to be assessing the falx cerebri and the falx cerebelli. So we're going to be going underneath into occiput and then the frontal. So we're looking for movement towards the feet on inspiration and flexion, and towards the top of the head for expiration or extension. Which I do feel, so that's about a 2. And then vault hold 3, we're assessing the spinobasilar synchondrosis, and this is the junction between the sphenoid and the occiput. So we're going to be coming under occiput, and then just placing our thumbs. Can you just clench your jaw, please? Onto the sphenoid. The greater wings of the sphenoid and the occiput are going to be moving towards the feet on inspiration and towards the top of the head on expiration, which we do feel. Excellent. So that's about a 2. So just looking at these numbers a little bit here, because of the ASIS and the vault hold 1. My clinical impression is that there is reduced square in both these areas, so your pelvic diaphragm or your ASIS, this would indicate a fascial dysfunction in the pelvic region, which would be also in alliance with or in congruence with your low back pain. And the reasoning for that is there could be a fascial restriction that can be identified by comparing the primary respiratory rhythm in different locations of the body. So the PRM is the fluctuation actually is cerebrospinal fluid around the central nervous system. As peripheral nerves continue from this CNS and connect with every part of the body, these nerves are covered in fascia, and this fascial connection actually comes back to the CNS and moves with fluctuation of the cerebrospinal fluid. And this reduced square in both the ASIS and temporal bone, assessed through the vault 1, can indicate a possible pelvic dysfunction, leading to low back pain. And by addressing any issues in the temporal bone and surrounding structures, you can influence the entire kinetic chain, helping to restore balance and release tensions in the body. So we're looking for contraindications now. So do you have any there's no acute fractures, acute TBIs, acute cerebral bleeding, or risk of cerebral bleeding? No. So the evidence that we can claim for this is a case study by Castro Sanchez et al. 2016. Benefits of this craniosacral therapy in patients with low back pain found this statistically greater improvement in pain intensity with craniosacral treatments than did 10 sessions of classic massage in patients with low back pain. So we're going to be doing some treatments today. So we're going to be starting with a pelvic diaphragm release as a global treatment. So this is going to be, I'm going to be touching your pelvis. Is that okay?
Yeah.
Okay, we're going to be placing this underneath your knees as a modification. So we're going to be placing our hand here underneath your sacrum, as well as a hand on top of pubis. Just we'd be waiting for a fascial release and for the sacrum to drop. For the sake of time, we're just going to be moving on to a lumbosacral decompression. This is the other global technique we'll be using. I'm just going to be placing my hand. We're going to be creating a space between L5 and S1. Where hand is going to be cradling the sacrum, the other hand is going to be stabilizing L3 to L5 with my finger pads. We're going to be tractioning the sacrum inferiorly about 5 grams while stabilizing L3 to L5. The traction until sacrum floats away from L5 in an inferior direction. And then the next step to this is one hand's cradling the sacrum and the other arm is going to be contacting the ASIS as immediately compress, allowing the sacrum to fall into the hands, and the SI joint releases that sacrum and falls into our hand. And we glide the sacrum inferiorly to finish. Excellent. Then we're going to be coming up to your temporal bone. We're going to be making an assessment first of the temporal bone. We're going to be assessing the anterior and posterior circular motion of the temporal bone. So we're placing the middle fingers into the external auditory meatus and the index fingers into the zygomatic process of the temporal bones and the ring finger on the mastoid. We're assessing the movement, which there is no movement. So we're going to also assess the mastoid wobble by supporting occiput in the palms of our hands, and the thumbs are on the mastoid. There's no movement, so we're going to do an osseous release. The local treatment for the osseous release is a membrane release of the tentorium. We're going to be using the cartilage of the ear as a handle. This is called the double ear pull. So we're going to be putting our thumbs into the ear and gently, with only 5 grams of pressure, pulling the ear posterior lateral, both of the ears, down and away. We'll be holding this until we felt the fascial release. Then the focal treatment would be an osseous release of the occipital mastoid suture, and this is a single ear pull on both sides. Again, pulling the posterior lateral on one side. We'd be waiting for that fascial release, and then on the other side. And then we're going to go back in and reassess the anterior and posterior circular motion. which there is now, and then we're going to assess the mastoid wobble. Which there is. So there is a wobble which is narrowing and widening at the same rate, and the AP circular movement we found was synchronized. So that's our reevaluation and our reassessment. How do you feel? Oh, and then we're going to go back to our listening stations and just reassess those, and then see if those have cleared up. Here we go. Let's see how we've done with those. We're just going to reassess those. So we had a 2 for the dorsum, which is still a 2. A 2, then the heels. Which is a 2. Our shins. Which is a 2. Thighs, which was a 1. That was a 2. See the ASIS, I'm going to touch your ASIS. Now that's a 2, that's more rhythm. The ribs, which was a 1. Feels more like a 2. The shoulders. Still a 2. Vault hold 1. There's now rhythm there, so I'm going to call that 2. Vault hold 2. That's a 2. And vault hold 3. It's a 2. And let's get you to slowly stand up if you don't mind, and we're just going to see how you feel. Are you feeling a little bit of release in that low back?
Yeah.
Okay.
Yeah, feels really good.
Okay, awesome. Thanks for coming in.
Thank you.